Hi, welcome to a brief tutorial on performing arterial tests with the PADnet 4.0. We'll discuss scheduling a patient, performing a complete test that qualifies for reimbursement through Medicare using CPT code 93923, as well as completing and submitting that test. Let's begin. First, we'll schedule the test on the website PADnet.us. This is also called the PADnet Read site or the PADnet Remote View site. On the iPad, you'll have two icons. The one that will take you to this website will be labeled Biomedics Remote View. Sign into the website by entering your credentials and clicking Log In. Agree to the terms and conditions by scrolling down to the bottom of the page and clicking I agree. Click on the Patients tab at the top. On this tab, you'll see a list of patients you've previously tested. If you're looking to reschedule a patient, you can sort by date of birth, name, ID number, or use the search field. Today, we're going to create a new patient. We'll begin by entering the patient's demographic information. This includes the patient's first name, last name, date of birth, sex, and identification number. Some offices like to keep records consistent by entering an ID number associated with the patient. Some offices are happy to have the system auto-generate that ID number. You should also select your referring physician from this drop-down menu here. If your doctor has never referred a patient before, you can add doctors to the list by clicking this plus sign. You'll also need to include the patient's street address, city, state, and zip code. You'll also have the option to specify the patient's race, ethnicity, and preferred language. Once you've entered the information, press Save in the bottom right-hand corner. To move forward, click on the Insurance tab that appears at the top. Here, you'll need to enter the insurance type, the carrier, and the policy number. If the patient has a secondary policy, you can enter that information here as well. Once that's complete, click Save in the bottom right-hand corner. Now click on the Tests tab at the top. Use the Schedule Test drop-down to choose which type of test you'll perform. Today we'll do an arterial or PAD test. On the left, under Indications, you'll be able to select appropriate indications for a study. We are going to select ICD E11.59, a very common code for a test. Once the indication is selected, the screen will refresh. Then you'll be able to select which procedure you're going to perform. We're going to perform the test consistent with CPT 93923. Once you've selected that, the screen will refresh again, and you'll be able to see both the ICD code and the CPT code you selected. Click Save and Next. You'll be taken to the History tab. You'll have the option to enter notes on the patient's history in either the right or the left-hand fields. Be aware, the note field on the right-hand side will appear on copies of tests that are provided to the patient. Once you've entered all the notes on the patient, click Save and Next. The last tab is the Test Details tab. Under Test Segments, you can review which segments are pre-selected for the patient's study. If you want to skip certain segments, or add some non-essential ones, for example, toe pressures, you can check the boxes on the left side here. On the right, enter the patient's height and weight. Then click Schedule Test. You'll be taken to the Scheduled Tests tab. You can see the patient that we scheduled at the bottom of the screen. Congratulations, you successfully scheduled a patient for the PAD test 93923.
This test will be available to you the next time you log into the PADnet Mobi website.
In this section, we'll discuss performing the arterial test. We'll discuss patient preparation strategies, taking blood pressures, and capturing pulse volume recording waveforms, or PVRs. Patients should present for the study in loose, comfortable clothes with their arms and legs bare. Shorts and a t-shirts work well. Patients should not have consumed caffeine or tobacco in the 30 minutes before the start of the test. While performing the test, patients should be lying down with their legs level with their heart.
For best results, make sure that the patient participates in a rest period prior to the beginning of the study. Patients should lie down without moving or speaking for 5 minutes to allow their heart rate to return to its resting level. At this point, you'll need to connect to the PADnet.mobi website. This is the website where testing is done. To log into this website, you'll need to be connected to the PADnet wireless network broadcast by the device. On a laptop, the web address is https://padnet.mobi. You'll need to enter the address exactly in order to reach the website. On the iPad, to reach the Mobi website, hit the app button labeled PADnet Testing. Your username and password are the same as on the Read website. Scroll down and agree to the terms and conditions. You'll then be presented with the website dashboard.
You can see next to Scheduled Tests, there's one scheduled patient. If you double-click that button, you'll see that this is the test for the patient we scheduled a minute ago. Click on that patient. The PADnet device will take a moment here to equalize or zero the pressure. Once the pressure is zeroed, you'll be taken to this dashboard. Under Scheduled Segments, you'll see a list of the segments required for the test you selected, as well as any additional segments you entered specifically. Start the test by clicking BP right arm, the first segment in the test. In this section, we'll discuss obtaining a blood pressure. The PADnet uses a photoplethysmography or PPG probe to capture blood pressures. Blood pressures are taken at the arm and at the ankle. For blood pressures at the arm, the probe is best placed on the first segment of the pointer or middle finger, close to the palm.
Make sure that when you're testing the right arm, you have the probe on the right hand, and for the left arm, vice versa.
For blood pressures at the ankle, the probe is best placed on the big toe. To begin, click Start. At the top of the screen, you'll see the status change from idle to starting to capturing. After the cuff inflates, a trace line will begin moving across the screen. As you can see, it's fairly flat. This is because the patient's blood flow is occluded by the inflated cuff.
This small irregularity in the trace represents the return of the patient's blood flow.
It can sometimes be difficult to know whether a small triangle like this shows return of flow or not.
Wait a few seconds after you see this pulse to stop the test so you can be sure that it shows a pattern and not artifact.
Once you're sure that you're seeing a pattern, click Capture Pressure and then Stop. At the top of the screen, you can see a scaled down version of the entire trace. Double-clicking will place a red line. In the top left corner, you can see what the pressure was at that location on the trace.
Remember that we're looking for the patient's first pulse as flow returns to the limb. To navigate to the earlier sections of the trace, click Previous Increment in the bottom left-hand corner. On this section of the trace, you can see the first few pulses of the patient's heart. We're looking for the first one, which I've highlighted in red. Double-click that spot to place the red line. You can see the pressure at that point was 121 millimeters of mercury.
That pressure selected, click Next Segment. The other pressures at the arm and the ankle will follow the exact same procedure. Here's the first blip. Let that test run long enough to ensure that you're looking at the patient's pulse. Then click Capture Pressure, and then Stop. Navigate to the correct portion of the trace, select the first pulse, and then click Next Segment. At this point, we're going to move on to capturing pulse volume recordings, or PVRs. Pressures, like the kind we just did, are done on the arms and the ankles, while waveforms are done on the legs at the above the knee location, as well as on the calves and the ankles. Waveforms are a little easier to capture than the pressures since we don't need to select anything, just take a good picture. To begin, click Start. Once you do, you'll see the waveforms begin to move across the screen. What we're looking for are consistent waveforms, that is, the peaks and the troughs are in about the same place. When you feel you've got a good image, click Stop.
This section here looks appropriate. As you can see, the tops and the bottoms of each waveform are in approximately the same place, and the waveforms appear to be level.
In the top left corner, the computer makes a guess as to whether the PVRs indicate a patient to be healthy or to have mild, moderate, or severe PAD. This is additional information for the interpreting physician and should never be considered or referenced by the technician.
In some situations, you may see a waveform that's too large to fit comfortably on the screen. Underneath the waveform is a drop-down menu labeled Gain. When you see a waveform that's too tall to fit on the screen, you can make the waveform smaller by moving the gain from 1 to 0.5 or to 0.25. You can also use the gain drop-down to increase the gain, making the waveforms larger or taller. There isn't a situation where you should do that, however. Waveforms taken on the toes are already set to be as large as possible because the vessels on the toes are so small. So the interpreting physician is making appropriate comparisons. Make sure that when you need to change the gain on one segment, you change the gain on the opposite segment as well.
Once you're happy with the image, click Next Segment. Once you've completed all the required segments, you'll be taken here. The segments you've completed will have green check marks on the right-hand side.
You'll also have the opportunity to test other segments before you complete the test. Many offices obtain blood pressures and PVRs on the toes in addition to the other segments. Once you're done, click Next at the bottom of the screen. You'll be taken to a screen where you have the chance to review all your completed and skipped segments. Farther down on the screen, you'll have the chance to leave all necessary notes as well. To complete the test, scroll to the bottom of the screen and click Save. Please note that if you fail to hit the Save button following the completion of the test can become lost. As you can see, the system informs you that the test has been submitted to the read site, where we entered the demographic information at the beginning of the test.
Once the test has been completed, it migrates back to the remote view site where we scheduled the test. Log back into the remote view site, agree to the terms of use, and in the Tests tab, click on the Unsubmitted section. You can see the test we performed at the top. Click on the blue hyperlink under the test type to proceed into the test. On this page, you can add notes or view the preliminary report. To send it on to the interpreting physician, click Approve and Submit. This is when your signature is applied to the test. Afterwards, you can see that the technician has approved the test. Congratulations on completing the test. Please feel free to reach out to Biomedics customer support with any questions. Have a nice day.